This is a case presentation by Brandon Buchanan. The case study presented is based off Batman Begins. In this movie, the character's focus is Bruce Wayne. He is portrayed as a man finding his purpose and overcoming his fears developed through childhood. To accurately understand Bruce's fears, one must understand that the city of Gotham was under severe depression, a giant city succumbing to the corrupt of the rich and powerful, a place full of hard times and desperate people. It was this environment that fueled what would become Bruce's anxiety mental disorder. The diagnosis that I concluded from the film as mentioned previously is anxiety disorder. An anxiety disorder refers to people who are prone to extreme fears and worries, often leading to panic attacks, phobias, and mutism. In this film, the first fear Bruce acquired was the fear of bats. After falling into a well, bats swarmed out and began attacking him. He was trapped, hurt, and had no way to help himself. Considering the scenario, if Bruce was able to go to a therapist, they would have probably brushed it off as minor trauma from a scary experience. He was a pampered rich boy playing in the woods who fell down the well. This would have been a likely scenario if not for the fact that his parents would shortly die afterwards because they left an opera due to him becoming scared of the costumes. In a broader sense, this disorder would not always be diagnosed. Many reasons contribute to this, like different values, perceptions, and developments. In America, men are generally often taught to not show certain emotions, especially fear. In case they were to be mocked or shamed, they would usually brush it off and not even realize the disorder themselves. In our culture specifically, the word disorder is usually associated with negative things like fear, disgust, and anger. Certain stigmas have arisen due to media, movie, and literature. Every time a mass shooting occurs, words such as disorders appear for the assailant. If a person walks into a room and announces they were schizophrenic, nobody associates with that person. This is because they fear people with disorders. Some evidence of Bruce Wayne's anxiety disorder is concluded from several facts. One of the most prominent is his fear of bats. This would cause panic attacks, the abrupt onset of intense fear. During the final trial for the League of Shadows, when he opened the chest, bats flew out, causing him to fall while remembering his experience of being attacked and his parents dying as well. Another symptom is agoraphobia, avoidance of situations involving your fear. Although related to panic attacks, this symptom is appropriate because Bruce is seen as a man who covers his fear and anger. The leader of League of Shadows accuses this of him because he went to a prison camp just to fight criminals daily. A symptom that was not as prominent was selective mutism, one where the person affected by this does not speak or generally avoid a situation where the cause of disorder is presented or mentioned. Bruce had a hard time admitting to his fear, but he was able to overcome them after the trial of the League of Shadows very early on in the show. The current Bruce Wayne has overcome his fears, but as for a treatment for his earlier self, I would have proposed different solutions than what he had. I would have proposed controlled exposure, allowing the patient to face his fears in a controlled environment to allow him to understand and overcome his fears. Bruce had a phobia of bats because they induced fears and panic attacks of his parents' deaths. He blames himself for this death. By allowing him to confront bats slowly and gradually, he would have been able to see the bats for what they were, just animals, and see that his parents' death as a reason beyond his control. Various ethical concerns may have arisen from this treatment. One of the biggest concerns would be allowing the patient to feel scared on purpose. The goal of treatment is to heal the wounds, but this method is like cutting open a wound again so that it may heal correctly later on. The reason Bruce did not receive the proper treatment is mainly situational. With his parents' death being associated with bats at such a young age, people often mistake or downplay the symptoms he displayed, and thus it was ignored. This disorder was portrayed accurately, from the cause of it to the linkage of an animated object like bats to the severe emotional turmoil of his lost parents. This fits the criteria. The symptoms of lack of sleep, recurring nightmares, physically incapacitation all correlate to anxiety disorder. In a broader sense, the displaying of disorders and films certainly affect how people perceive and understand the cause and effect of the disorder. The type of villain is also a factor. In the case of Batman, it is seen as someone emotionally distraught, overcoming his fears and becoming a hero. Movies such as horror genres portray the disorder victims as scary, dangerous people who would harm others and become the villain.